As a special guest, Dr. Ken Vehec, who is the program coordinator for MyHealtheVet. Emphasize the E, meaning electronic.
Electronic.
Right, Doc?
Electronic. That's it.
Yeah, and we've been talking about the My Healthy eVet, expanding program from the VA that's available for veterans and non-veterans alike. Gives you a way to manage your own health care issues, particularly if you're enrolled with the VA healthcare system, and it's going to grow in the future to give you more and more features. And we ended up talking about enrolling in My Healthy eVet, so you need some computer access to do that. And if you're not computer literate or you don't own a computer, let me tell you one thing. You can go to any public library and there are computers galore available for your use. So write these sites down that we tell you, because you can then go to the library and use it. If you don't use a computer at all, come to my office. I got computers and we'll do it for you.
Also, the vet centers all have computers that are accessible for the vets. You
Good
can walk
point.
in there and use that. I've had that set up throughout Central Florida. The
VA outpatient clinics?
The one in Vieira has 2. They're getting 2 more kiosks specifically for My Healthy Vet.
Great.
And we're expanding this project all over. And eventually what I'd like to do is put kiosks in VFWs, in DAVs, throughout the community, so you don't have to go to a VA facility. I was just speaking with Dr. Goldberg, who is our chief of staff and my direct boss, yesterday about this. And this is the area that he wants me to pursue, so the support is there. And
Can we touch on the leadership for a moment here? You mentioned Dr. Goldberg.
Yes, I would.
We know Mr. Lazert is the chief over there in Orlando.
He is our director. And I feel very fortunate about having both Tim Lazert and Dr. Ken Goldberg as the actual driving force for my program, the support that I receive. They're young, as opposed to some of the other VAs that I've been in. So their ideas are, let's see how we can move this forward. Let's use as many tools as possible. They're not afraid to try different things. Obviously, they gave me this job, so they're not scared of a lot of things. But they've been really supportive. Dr. Goldberg has actually set up medical centers in North Carolina before, like what we're doing here in Orlando. I don't know if people realize the enormity of what we're getting as far as a medical city.
I don't know, $600 million.
Yeah, $600 million. But think of it this way: we're also in an area that's going to have Burnham Pharmaceuticals, Nemours Children's Hospital. We have UCF Medical School, and now Florida Medical School that's going to be there as well.
So
the talent that's going to draw.
Pool. Sure.
And I came from the Pittsburgh VA system, which is surrounded by 5 medical schools, and all the docs had to do rotations through there. When heart transplants were first being done at the VA system, Dr. Starzl, who was the pioneer of that, was actually doing them inside the VA all those years ago, training the docs in the VA.
So top-notch care, medical city, all those resources pooled together, residencies and internships, things like that, cutting across the university to the VA level.
Correct. And that's what Dr. Goldberg has done before. He did that up in North Carolina, so now he's here to help us and guide the program through that phase, and hopefully to continue on in its development. This guy is just, he's so tech savvy, so unlike any other type of leadership I've ever had before.
Well,
Awesome
I want
guy.
to share a little anecdotal story here for a moment. My grandfather, who's now passed away, at the time he was 92 years old. Last thing, now he was an engineer by trade. He had like 8 patents, very smart man. He hadn't seen a computer, had never even worked on a personal computer. And I said, you know what, you're a smart man. Even if he wasn't, I'd have told him that. You can learn this stuff. Within plugging it in, hooking it up, getting it online, he flew. He soared with it. Because fortunately at this day and time, it's fairly easy to access the internet and navigate through the sea of information out there. But you mentioned that there's an application, or what was it, on the iPhone?
Oh, on the iPhone, yeah.
Neat little story here, folks.
Neat little. Everybody says that this isn't going to be for the the older vets. They're just going to say, oh my gosh, and stay away. But actually, that's our fastest growing population as far as registration for MyHealtheVet. And there's a patch that was written for the iPhone for MyHealtheVet that was written by a 72-year-old veteran because he wanted to be able to use his iPhone to access MyHealtheVet while he was out and about.
So folks, feel comfortable with this. And if they have questions, gosh, there's plenty of resource to find out how to navigate, how to get engaged with it.
Oh, yes, most definitely.
And knowing that it's at the vet centers, which pretty much all metropolitan communities certainly have a vet center or two, or VA outpatient clinics, as you said, at the Vieira Clinic for those folks here in Brevard County. There's 2 computer kiosks right there, and I think it's the release of information section.
Yeah. And there are 2 at the Melbourne Vet Center on Sarno Road.
So there's no reason not to. And as Glenn, you said, the library.
That's correct. And there's, people know where the libraries are because particularly people in my age group use the library a lot because it's a great place to hang out and you don't have to pay anything, obviously, to use the library. While we were talking there, you touched on the upcoming VA Medical Center in Orlando, and I wondered if you could give us an update on what's the latest on the opening there.
Well, as I understand it, we are going to have a ribbon cutting next October, and services will begin to be rolled out from that point forward. Now, it may start off as outpatient, and then as other services get added, as the hospital becomes more and more complete, and then phase into opening the doors to a full hospital. But we're on task and on schedule, as I understand it, from our public affairs office.
Well, that's on schedule from everything I've heard for the past couple of years, which is excellent, and really looking forward to that. That's going to be such a boon to the healthcare of East Central Florida, who has the most underserved veterans population in America, and that's why they're building that hospital. There's over 400,000 veterans in that catchment area.
Oh, yes. And I encourage anybody that's driving past on 417 to see the construction to actually get off the exit ramp and drive down to the gates and take a look at it. It's a wonderful site. I've had the opportunity to tour through it and drive around through it. It's going to be wonderful for us vets.
If you're looking at it from 417, which is the toll road that goes around Orlando that way, if you're headed to Tampa or Disney World, it's the one out there under construction, the huge building under construction. It has the scoop roof on it.
Little wings. Looks like they're going to fly.
You bet.
And you've got a live webcam set up also.
Yes. If you go to the Orlando site that we mentioned earlier, the orlando.va.gov, you can actually watch the construction that day. And also archive footage where it downloads, I believe, at like 5 minutes at a clip that you can watch a time lapse of the construction. So please go take a look at it. You will be proud to be, even prouder to be a veteran when you see the construction.
Well, that's very cool, and that way you don't even have to pay a toll.
There you go.
The expansion of the facilities is a natural tie into what we're talking about here with this program available on the internet, this MyHealtheVet. Right. Let's get back to the nuts and bolts of this. You mentioned that it's going to provide greater access for the vets to engage their healthcare provider. Let's go through some of the other items, some of the other issues that this tackles.
All right. Number one, what drew me to it when I first started using MyHealtheVet about 3.5 years ago, even before I became involved in this, because I've only been on board as the coordinator since November of last year, was that the ability to go ahead and renew my prescriptions. I'm diabetic as a result of the missile explosion. I've got a lot of other issues. I've got over 20-some meds that I have to reorder on a monthly basis. Before, I had to dial in.
So you're telling me I could go on MyHealtheVet and reorder my meds?
Yes, you can.
Impressive. Are you listening, folks?
All you have to do is sign on, click on my prescription refills. Your meds will show up by name with a little radio button. You click, 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 hit submit, and within 10 days they arrive at your house. Rather than dialing in and then punching in all those numbers on the prescription bottle. It's that simple.
That's impressive.
That was the first one that we had out there. Now, the veterans can go on and see their labs. Any lab work that you've had done after 7 days, it'll appear on the website.
Which is impressive, so we can order our medications, we can check our lab results.
Right. We can also see pending appointments. Whatever appointments you have scheduled in the VA will show up onto your health calendar. And then after that, we're going to have the ability to download your progress notes. So no longer do you have to go to the release of information, fill out the form, wait for an hour or however long it's going to take, because it's usually a long line of people who want to get their records. You can go right online and download them, and that's being rolled out over the next year.
Okay, you mentioned appointments. Let's touch on that again.
Okay.
You're saying I can go and see what appointments I've already established. Can I make appointments while I'm on MyHealtheVet?
No, you cannot. You can only see what you have available and what's been made for you.
The system is only, it's limited. I mean, you can't.
It's limited, but it's growing. Now let me explain what I'm talking about on that. Through the latest feature of secure messaging. Secure messaging is where you will have the ability to go ahead and send a message to your team, and it's as secure as if you were sitting face to face with your doctor in an exam room.
So this is a back way into making an appointment, possibly.
Exactly.
Explain this again.
No.
I go on MyHealtheVet. I'm logged in,
Right.
and I want to say to my doc or my nurse, "Hey, I think I broke my finger."
Yeah. Right. What has to happen first, so you have to be registered for MyHealtheVet, but you also have to have the in-person authentication. You have to have an upgraded account. And in order to do that, you just go through the secure messaging area where you click on that. You'll watch a video about secure messaging. Then you have to fill out what's called an in-person authentication form. You take that to the VA. You can take it to your team, or you can take it to the release of information.
So you would download that?
Yeah, download it right there. Fill it out. Take it into the VA. Show them your ID. Show them the piece of paper. They authenticate you right then and there. And from that point on, you have full access. The whole website is open. You never have to do anything else as far as authentication in the VA system, and also the e-benefit system. We'll get to that a little bit later on. But back to what you're saying, once you have secure messaging ability, and by October 1st, all primary care teams in the Orlando VAMC system will be using secure messaging. So you'll be able to send your team a message, "Doc, I broke my finger. I think I broke my finger." And they'll say, "Well, we need you to come in to have that x-rayed. We've set up these appointments for you." And you'll get that back in a secure message.
So it's a two-stage process, getting enrolled on MyHealtheVet, and then you have to do this in-person validation or confirmation.
Authentication, yeah.
Authentication, your IPA.
Yeah. It takes approximately...
Where do they do that?
They do it right on the website. The video is located right on the website. It's an 8-minute video. And then the form is a release of information form, which, Glenn, how long does it take to fill out a release of information form?
30 seconds.
There you go. So, and then you take that in.
Present to a VA somewhere.
Yeah, present it to the VA somewhere. They will then take it, enter your information in. It takes about 3 minutes to authenticate somebody. Traditionally, you have to wait about 24 hours because the computers update themselves at midnight every night. And once that authentication goes through, you're done.
All right, getting back to my original scenario, a person, a man or woman vet, has never engaged the VA before. They go on MyHealtheVet, get that ball rolling, listen to the video, watch the video, download the form. They go into, let's say, the VA outpatient clinic nearest them, and they don't have their VA ID card that has their picture on it. All they have is maybe their retired military card. That's all they're going to need?
That's all they're going to need. Any type of official photo ID. It can be a driver's license. It can be a retired ID card. Anything that's issued by the state. It can be, like here in Florida, we've got the state ID cards. Anything like that.
And speaking about enrollment issues, again, Glenn, what's the number one piece of information they need to take to the VA?
Well, the number one piece of information you need to take to the VA and enroll is a copy of your DD-214.
And what is that?
That's your statement of military service, shows when you went in, when you got out, and the type of discharge you had, all of which affect your potential eligibility for health care. And if you're like 90% of the veterans that I know who, even after being told this is the most important document you have, you lost it, you can come to our office and we can help you order it online, and you'll get it within about a 3-week time frame unless there's something unusual about your case from the National Personnel Records Center. And they'll send you 2 certified copies, and from there you can even put one in the county records so that if you lose it again, you can easily access it without having to go through a 3 to 4 week waiting process. But that's the key document to get the enrollment process going. I mean, there's other enrollment eligibility factors, but you gotta have that DD form 214.
Yeah, that's the
and
minimum.
also with the DD-214, you're going to be able to, if you have the ability to scan into your computer, you can scan your DD-214 into your MyHealtheVet account.
Excellent.
Neat.
That's
deal.
even better than putting it in the county record.
Yeah, because again, like I said, you can take that with you no matter where you go on the thumb drive.
Yeah, but is this protected? I mean, somebody might skip away with these records,
It's
right?
your information, and it's on a secure website.
It is secure.
This is so secure. Just to give you an indication of how secure it is, when I boot my computer up and access the site, it takes about 15 minutes for my computer to make it through all the security levels I have to go through to be able to access the website.
Well, that's impressive. And I like the fact that we've graduated to the next stage, which really happened somewhat recently, didn't it?
Yes, it
With
did.
this IPA you mentioned.
Yes, this is brand new. Well, not brand new. It's within the last year is when they really started to try to get people to do the authentication, because all of these new services that are coming out have to be behind the firewalls. So therefore, the need for this
Which is the security I was talking about.
Yeah, the security. There is so much in place that every time I go onto the website, if I'm helping a
Doc,
vet,
folks are really worried about their information getting out, or they don't
understand,
want it.
and myself as well as a vet. I wouldn't be out here saying go ahead and use the site if I didn't believe in it myself. As a disabled vet, I use it, I trust it, and because I know the inner workings and I've seen how it works behind the scenes and what has to occur for somebody to have, for someone like me who has access to their health records on a regular basis. Right, I can go and I can see everything because as a doctor I have full access
Sure.
to CPRS, but I still have to have all these securities, all these passwords in order just to access the site, to be able to help somebody do that.
And folks, you should take this as a positive that you have to show up with your person and your
Yes.
ID, your DD-214, whatever it is, to get verified and confirmed to go to the next level, which is a neat deal.
It is.
And let's talk a little bit more about that. You talk about this whole secure messaging by October 1st.
October 1st. All the primary care providers will be using secure messaging in some way, shape, or form. That's
So we
the
can
mandate.
reorder meds, we can check our labs, x-ray
Yep.
reports.
X-ray reports, whatever else is going to be on there. It's whatever's in your health record, you'll be able to have access to. And that's going to be rolled out. Again, don't expect everything as of October 1st. These are soft rollouts as these programs become developed and adapted to get through the security protocols so that they become accessible everywhere. So we're fortunate here in Orlando that we're one of the sites that gets rolled out rather quickly because we are so large and we are new and we we do have such a great supportive team.
That's great, and when we get to that point, which looks to be in the pretty near future, all things considered, somewhere after October, where you can access your entire medical record through MyHealtheVet, will there be an ability to print your data that you're looking at? You're looking at maybe the notes, treatment notes from your last visit to your doctor. They're sitting in my office. We access the account for them, and we need to print that as a piece of evidence to support a claim we're going to do for them, rather than have them go over to records and say, give me a copy of XYZ.
Yes, once you have it downloaded onto your blue button, it's your information. You can print, you can do whatever you want with your record.
Excellent.
Everything.
Yeah, everything. And there's really absolutely nothing that the veteran cannot do with this website. Whatever features are there, at that time, the veteran has all access. As long as you have the IPA, that is important. You have to have that in-person authentication to have full access to the sites, to your record.
But there has to be that reciprocity. If the vet communicates with his caregiver and says this, that, or the other, or I looked at my lab and it doesn't, did you notice that this level was really high? You never called me, something like this. What kind of exchange back and forth is there going to be? Are they going through education and lessons to learn how to communicate with the vets?
Yeah, there are training programs that I do on a weekly basis throughout the VA systems on how to use this program. There are
So within the VA, you're teaching the VA employees.
Not the VA employees and the veterans. The classes that I hold are for employees and for veterans. Also, the new veterans coming in that are getting the new patient orientation, MyHealtheVet, secure messaging is all part of that initiation into the VA system. So,
Impressive. And you mentioned earlier that you're available. If there's a large veterans group or a collection or a gathering, such as this afternoon, folks, I want to just throw this in there real quick. At Palm Bay, American Legion Post 117 off Malabar, there's an Eastern Region meet and greet. Encourage everybody that's a Legion member, maybe you're a member of the American Legion Riders, Patriot Guard Riders, whoever, whatever, if you have some affiliation with a veterans group, stop by. AVET Project is going to be out there. But in a situation like that, when you've got a collection of veterans coming together, maybe it's a convention, a conference, you're making yourself available to come and give a briefing and some discussion about this program?
Yes, I am. I'm making myself available for that, but not only for that. But say your VFW is having a meeting and they want to discuss how they can help their membership, and they want to say, oh, well, we've got some people that are interested in enrolling. Give me a call. I have no problem coming out. As a matter of fact, I enjoy going out and meeting with the other vets because, hey, that's what we do. We like to interact with each other. You know?
Well, this might be a real good time then. I mean, I was going to say, folks, if you want any more information on this, you can get a hold of avetproject.org. You know, just www.avetproject.org. Go to the bottom of the home page. In the lower left corner, you'll see the Facebook icon. Click on that. Don't have to be a member of Facebook. Just click on it. It'll take you there. You can navigate through all the pages, look at discussions, see recent interviews, all that jazz, and we'll have a posting about this MyHealtheVet program and some information on how to get a hold of Dr. Ken Vehec. But what do you want to share with them? Do you want to share a website or an email?
Oh, sure. You can always contact me through my VA email, which is kenneth.vehec@va.gov. So that's Kenneth.
Pretty straightforward.
Yeah, very, very simple. Kenneth.vehec@va.gov.
And that's VEHEC for you folks out there that might be unaware of how to spell Vehec.
Oh, sure. Now reveal me totally.
Kenneth.
Yeah, there you go.
Kenneth.vehec@va.gov. Out of the Orlando VA Medical Center, the expert and the program coordinator for MyHealtheVet. Sounds like a really neat program. I know it's been in the works for a long time, but we've just taken a big jump ahead.
Yes, we have. And it's just going to get bigger. There are more and more things that we're going to be able to do as this program becomes more expansive and more integrated into the fabric of the modern day VA. It is just a wonderful program, and you need to get on board now as a veteran so that you become more proactive in your care, because that's what it's going to take.
And your information is safe. You heard it here.
It is safe.
It's safe and secure, and it's participatory. If you don't get involved, it's not going to do you any good.
Right.
But there's all kinds of resources on MyHealtheVet aside from the things we're discussing.
There is so much on there. You could spend basically a full day just accessing and looking around at the information that is available. Not only about MyHealtheVet, but if you go to the Orlando homepage, you'll see everything that they have scheduled, the events that are planned, the education that is available for veterans on a daily basis. There are classes that are filled with all types of information that's being disseminated to the veterans throughout all the different areas that we're in. And I also wanted to say that the people in Melbourne are very fortunate to have the Vieira Clinic, because the Vieira Clinic was our very first test site for MyHealtheVet and secure messaging. Dr. Pena and his group over there, Consabrina, Martin, and those people are just doing so fantastic as far as getting the information out, getting people enrolled, becoming proactive. It's amazing the site that we have over here. The people over here are just wonderful.
And I'm really excited, as I alluded to a little bit earlier, about the positive implications this can have on the claims business. It's one thing for you to tell me what you think the doctor wrote down in your record, and it's another thing if we can look at that right there and see what they said, and that's going to help me to further help you to the best of our ability.
So you got to get enrolled in MyHealtheVet. You got to do the IPA.
Yep.
What's that stand for again?
In-person authentication.
So you know that your information is safe and secure and only you are going to have access.
Correct.
Once you do, you could download a report or a progress note, get it into Glenn's office. See how this all works together? It's a win-win, folks. We definitely want you to participate. Dr. Vehec, thank you so much for being with us today on American Warrior Radio. Really appreciate it.
This has been
Look
my
forward
pleasure.
to some future visits, too, and regular updates as to what's going on. Thank you, folks, for listening to us today on American Warrior Radio. It's been a great day, a lot to cover here. If you have any questions, you can always check out www.avetproject.org. And as always, Glenn,
don't forget, think of that.